Welcome to the Mental Health Hour. Welcome to our 77th episode. Um, and welcome everybody uh, to Agoraphobia.
Or
That's what we're,
agoraphobia.
or agoraphobia. Um, I'm sure we'll be getting. Remember that broadcast we did way back when? We got to find that. There was a broadcast we did where we did
Saying different things, yeah. We should do that
yes,
again.
yes, Brits versus Americans.
Mm-hmm.
Uh, it was a I forget all the words that we. I'm sure it is on. Is it on our YouTube channel? It might be.
Yeah, I
I'll
think
look
it
for it.
might be mine. I'm pretty sure it's on mine.
I know it was saved, but I'll look for it, and
Because we could do
we'll.
something like that, but also, because we just did the words that we say differently, but there's a lot of words as well that have very different meanings, as I've found out a few times. Usually, mm, it has a very different meaning. Like, just no, I can't think of anything that's not rude, so I best not.
That's not rude.
Yeah.
Um, well, let's say hello to chat. Hello, chat. Tracy, we got Mr. Med in the house. We got Eric and Naomi Hattie. Hattie. It's good to see everybody. Good to see you guys. Glad everybody is here. I'm looking through here. Yeah, so tonight we're talking about agoraphobia or agoraphobia. Gemma,
Mm-hmm.
what do you know about agoraphobia? Agoraphobia.
I know that I had it after a very nasty split for quite a long time, and I was a complete recluse in my house. Didn't leave the house for about 7 months, something like that. Um, so yeah, it's a fear of wanting to go out. Can be for various different reasons. Um, but mine was due to having been more or less kept captive in the house due to a somewhat violent relationship, to being then freed of that, to being terrified of going out on my own. So it can be really, really difficult to come to terms with and get out again, but it can be done. I'm not like brilliant still at times. I don't like going out on my own, but I have found ways in which I can cope with it now.
So, what are we starting with here? Are you agoraphobic,
Yeah, I was. I
or
still,
would you say you're just more introverted?
more, yeah, I'm more introverted now, but I was diagnosed as having agoraphobia for a good 7 months. I didn't leave the house at all. Everything was delivered to me. Um, I
Because there
just,
is a difference.
oh yeah, definitely.
Yeah, I
But
mean, it's one thing to be introverted. You
hmm
know, you don't want to go out. You don't want to
yeah,
mingle around. But to be truly terrified, and I think we had uh, one of our chatters from back in the Haps days,
yeah, I know.
TJ,
Yeah,
wasn't it? He
yeah,
was
yeah.
uh, riddled with this, or um,
hmm
struggled with it. Um,
Yeah,
uh, I just thought about that, and I would love to reach out and see if he'd like to come on and talk about it.
Mm.
But
It really can be difficult. Like, when I say I was terrified of going out, I did not even leave my front door. I wouldn't go out in the garden or anything. It completely controlled my life, and because I had a baby at the time, or young toddler, it was awful. I couldn't go to the doctors, I couldn't go to appointments, I didn't leave the house. And,
mm,
bit by bit, I got through therapy and stuff, I got where I could. I'm still not brilliant out on my own, and I have to disassociate when I'm out on my own by putting, like, loud music on or something to completely disassociate from being outside. That's the only way I can do it when I'm on my own. But aside from that, it was the very first time I went outside the front door was, I had a complete meltdown, completely broke down, had a huge panic attack, and, yeah, not great.
so
But that I, ended up using live streaming to get out a little bit.
I don't know if I'm coming through right now. Um, I'm
Yeah.
throwing frames.
Yeah, yeah, you can be seen and heard.
Excellent. Um, yeah. So I don't have any stake in this particular topic. Uh,
Mhm,
agoraphobia is. I think um, I've become more introverted since I've quit drinking and stuff. But that's
mm,
just to try to protect my sobriety and to be more. I, I'm not depressed or afraid to go out because um, of alcohol being out in the world, and it's not like one of those things. But I feel like my life has circled back more into a normalcy where I am always home. Um, kind of like a hermit
mm.
situation. Like
Yeah,
I'm
yeah.
I'm closed in, but I mean, I still go out. Like it's not unhealthy. But we just wanted to talk about agoraphobia or agoraphobia because it was a viewer request, right?
Yeah, 3 different people.
Three different people. So
Mhm,
we just wanted to talk a little bit about it. Um, Gemma has some dealings with it. I do not. So I am not the best person to talk to about this particular topic in mental health. However, we're going to run through the show just like we normally do, and
mhm,
I got a short video, and I wanted to. The reason I did the video is because of last, what was it, the holiday depression episode. We did um, the video, and it bugged out. Um, so let me see if this will work. If it does, then we will come back and talk about it. And if not, we'll figure something out. But here is a little short video on agoraphobia.
Agoraphobia is an anxiety disorder characterized by intense fear and avoidance of places or situations where escape might be difficult or where help might not be available if something were to happen. Agoraphobia is a more complex condition than what most people assume. They assume it's simply a fear of open spaces. But someone with agoraphobia may be scared of traveling on public transport, visiting a shopping center, or leaving home. Agoraphobia is often associated with panic disorders. The National Institutes of Health estimates that 1 in 3 people with panic disorder develop agoraphobia. Most people with the condition develop it after having 1 or more panic attacks, making them worry about another attack. This may cause them to avoid places where it may happen again. The fear experienced is usually out of proportion to the actual danger of the situation. According to experts, panic disorder with agoraphobia tends to be chronic, while the one without it tends to come and go in phases. Agoraphobia can begin in childhood, but mostly starts in the late teen or early adult years, usually before age 35. Older adults can also develop it. Those affected are at a higher risk of having depression and substance abuse disorder. Causes. Agoraphobia is caused by both environmental and genetic factors. Risk factors for the condition include a family history of the condition, having an anxious or nervous temperament, experiencing traumatic events such as abuse, being attacked, or bereavement, having panic disorders or other phobias. Symptoms. Symptoms may include detachment from other people, fear of spending time alone, of places where escape is difficult, or of losing control in public. Helplessness. Avoiding situations or needing a companion such as a relative or friend to go out to public places with you. Symptoms of panic attacks include rapid heart rate, excessive sweating, upset diarrhea, feeling a loss of control, chest pain or pressure, sudden chills, trouble breathing or a feeling of choking, dizziness, tingling, facial flushing. Diagnosis and treatment. Diagnosis is based on a clinical interview and diagnostic guidelines. The doctor will ask questions about symptoms, how often they occur, and in what situations. The doctor may also carry out a physical exam to rule out other conditions that could be causing symptoms. The doctor may also use diagnostic criteria in the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, published by the American Psychiatric Association. Treatment. It is uncommon for agoraphobia to resolve without treatment. Treatment options include psychotherapy and medication. Psychotherapy may be effective to help you understand your condition, how to cope with and tolerate symptoms of anxiety, communicate with others in social situations, and help reduce the feeling of anxiety. The form of psychotherapy used is cognitive behavioral therapy, or CBT. Therapists who treat the condition may offer initial treatment without the patient needing to visit them in their office. Medications such as selective serotonin reuptake inhibitors, or SSRIs, antidepressants are used for the treatment of panic attacks and agoraphobia. Anti-anxiety medications called benzodiazepines to temporarily relieve anxiety symptoms. Thank you for watching our video. Please do not forget
You're muted. There you go. Oh no, I can't. You have to do it.
I got it. So, what do we think?
Yeah, some of those definitely. I can relate with the panic disorders when you go out, because when I started to go out afterwards and I had the panic attacks, being out, it made me more wary about going certain places, going out, and made it harder for me to want to continue to go out. So you have to overcome that hurdle of the worrying of the panic
Yeah.
attacks. Sometimes worrying about having a panic attack can trigger a panic attack.
Yes, it can. Um, the the symptoms and the fear, uh, it to me it seems quite scary. Uh, if for those that go through this, um, I want to maybe reach out to TJ. Um,
Mhm.
he was a good friend back in the Haps days, and I think we can find him. I
I've got
believe that,
details for him.
yeah, I believe that he struggles with this, and I would love
Yeah.
to hear some commentary from him on
Mm.
exactly what he goes through. Um, I know he shared a picture of uh, what was it? They went fishing. Him and his brother went fishing, and that was like
Mm.
a big deal, to get out and get
Yeah.
out of the house and um, move forward out into the uh, comfort zone. God damn it! I could not think of uh, that word, comfort zone. Apologies.
It is, and that's a good thing to have when you have something like this, to have a goal in sight of something that you want to achieve from when you go out, so that you're going out for a purpose with having a goal in sight, so that it makes it so that it's something you want to do, something you want to achieve, but also allow it to be flexible, so that if you don't make it, if you don't achieve it, that
Yeah,
don't want to be beating yourself up about it. Just something small, it doesn't have to be something big, because going out itself is a huge thing. So just giving yourself a little bit of an incentive, but also if you make it out and do what you need to do, then reward yourself for it and journal it as well. That's one thing I did, journal all the times that I went out, how it went, how I felt, and it helps. It does help, and it shows all the different things you achieve, and you can look back on it and see how far you've come. So if you journal where you go, how long you're out for, the problems that you had, things you enjoy, and then you can look back on it and really see how far you've come.
absolutely. I want to take a look at quick couple slides for you. Um, what is agoraphobia? Gemma, if you would
Hmm.
please do your reading that you do so well, and
Oh
the
dear.
ASMR that is Gemma's slide reading.
Mm-mm. Uh, until I can't say certain words, and then totally one up. Okay, so what is agoraphobia? I can't say it like you, so you're just gonna have to have it the British way. Sorry. Agoraphobia is an anxiety disorder that will affect an estimated 1.3% of Americans at some point in their lives. People with agoraphobia avoid specific public places or situations because they anticipate having anxiety or panic attacks and being unable to escape or get help. In severe cases, these fears cause people to refuse to leave their homes for a prolonged period of times.
So Hattie was just saying here, pull this up. Never really understood what happens with panic attack, but I believe I dealt with them right before having severe vertigo attacks in the past.
Hmm.
Um, Wanted to touch on this. Panic attacks uh, are debilitating.
Yeah.
They can really take somebody down. Uh, on the
I've
ambulance
seen
we run,
people having a heart attack at times when it was a panic attack
I was
because
just gonna say, um, on the ambulance we run a lot of chest pain calls, and it's actually just an anxiety attack or a panic attack. Um, but people feel like it's a heart attack, like the pressure, the chest pain, the chest pressure, the respiratory rate goes up and down, and blood pressure up and down, and you know, just your whole uh, body, mind, and soul get out of whack when you're going
Well,
through that panic.
the whole thing is like a knock-on effect of it all stemming out of control, because you start with the chest pains, then you with the heavy breathing that will affect you being lightheaded because you're taking short, shallow breaths. It will affect your heart rate, your blood pressure, your SpO2 levels. I'm hearing myself back. Oh, that's weird. But
Yes.
yeah, it's not good. Definitely not good. The best thing to do when you're having that is get a paper bag, put it over your mouth and nose, and breathe in and out of it as slowly and as deeply as you can. Because that helps slow things down and get it back to normal.
I'm not going to uh, add on to that. The paper bag, I've never actually done it.
Mhm.
The It's a hyperventilating kind
Mhm.
of scenario, is it? Is it not?
Yeah, and that's why they say that if you put the paper bag over your mouth and nose, cup it with your mouth and nose, and breathe in and out into the bag, it's breathing it in back in and stops you hyperventilating. It
Yes.
does work. I have done it. But
Will you breathe into all the bags that you want?
well,
Looking at another. Let me pull down Hattie. Gemma, can you take us through this slide as well?
yeah. So agoraphobia definition. Agoraphobia is a panic anxiety disorder that is characterized by an intense fear of leaving the house or an open and closed public space. Housebound. Not all agoraphobes are housebound. Many have safe zones or places that they're comfortable going to, or that are necessary, or a person they feel safe leaving the house with. Panic. It can occur with or without panic attacks or panic disorder. Stats. The onset is usually between the ages of 15 to 35 years old. Fears. Public transportation, shops, theatres, restaurants, standing in line, crowds, in public, alone, irrational fear of something bad happening, comorbidity. Agoraphobia usually occurs with another mental illness, most often depression, social anxiety, PTSD, OCD, or generalized anxiety.
So they're not all. I'm learning a little bit here as well.
Mm.
I always thought that the agoraphobic person was always housebound. Apparently, that is not the case. Um,
Well, yeah, they would still have me down as having it, even though I go out. But there are still places that I really struggle with, like London Underground. I would never do that on my own. I tried it once and nearly ended up in the bloody hospital. Um, I struggle to go out by myself. I can, but I have to do it very short periods. But yeah, there are people that can go out, but have sometimes it can be the place of trauma. Like if there's a specific place that relates to a trauma, say for example, a park, they may be afraid of not just that park, but all parks, because of an irrational fear of something bad happening at a park or at a supermarket, say. So I think it was Tracy mentioned having a panic attack. And people might think if they've had a panic attack in a supermarket, for example, they could be worried about having another one. And it becomes a problem going to that kind of place because they think that it's going to happen every time. And usually, or I certainly was told, that agoraphobia is diagnosed after a number of panic attacks and irrational fears about particular places, not necessarily going out of the house completely, but it can be around particular places as well. Originally, I did think it was housebound as well, but no, it doesn't have to be.
Yeah. I just from the I guess movies and pictures and all of that, social media in general.
Mm.
I've always thought of agoraphobia as just that person that is kind of locked away in a house.
Mhm.
The hermit, as I mentioned earlier. Um,
Yeah.
and I guess, I mean, that's just not the case. Learning a little bit more about this, I was looking at something earlier and I wanted to try and pull this up, but I don't think it's going to let me because my internet is just kaputs. Uh, I'm still streaming. Okay, that's
Yeah.
are. Um, Everything's slow. But anywho, um, the I was learning. You can see. Let me pull this back up if it will come back up. Uh, the safe zones was very interesting to me, and public transportation, as we've been talking, theaters, crowds, the panic attacks set in, the PTSD, the sweats, the uh, you know when it's
Mm.
happening, you know the aspiration, the you just know that feeling, that panic attack feeling, and
Yeah, it doesn't usually give you much warning, but by God, when it comes, you know about it. But by then, it's usually too late to try and stop it happening.
yes, and I remember back talking with Ella um, in her episode. She had that panic attack in the store and still has trouble going to that store. And you were touching on that, weren't you, Gemma?
Yeah, yeah.
Yeah. Um, so comorbidity. Uh, can you? I can't. My screen has got that thing all blurred. Can you read that again for me?
Yeah, so it says agoraphobia usually occurs with another mental illness, most often depression, social anxiety, PTSD, OCD, or general anxiety.
It's just adding in on other, the PTSD, the OCD, the anxiety, generalized anxiety disorder, GAD. Um, it all comes together with the panic state or the fight or flight. Um, I guess when you hit that fight or flight moment uh, in the agoraphobic time. So it's very hard sometimes for me to try and explain something when I haven't gone through it, but I love, I absolutely love learning about these things, um, and just how similar they can, uh, wrap into what I feel. Um,
Mm.
I'm not agoraphobic, but sometimes I don't like to leave the house. Sometimes I don't like to uh, get out in the mix of things. It just, not that I get in a panicked state, but it doesn't fit me well that day. And it is kind of a day-to-day thing, isn't it? Would you agree, Gemma? Like, have you would you say that you, from day to day, like one day might differ from another day?
Oh yeah,
You know,
definitely.
could maybe tomorrow I'll go out and check shit out, but today I just feel like fucking staying under my blanket and
Yeah, definitely. There's some days I just don't want to deal with people. Period. I'm just like, nope, not today. And it
but
doesn't
like
have to be anything other than you just having a bad day, and tomorrow hopefully will be a better one.
But see that's getting into fucking depression. Like
Hmm.
we're not even talking about agoraphobia anymore. Let me take this slide down. um what we're getting into depression and like introverted people.
Mm-hmm.
Um I am, like I said at the beginning of the episode, I'm very introverted now. I like to be inside. I like my house. I like my domain here. This is my kitchen. Well, my kitchen's over there, but this is my living area. Um, Penelope's in there watching Tangled for the 150,000th time, and everything is just so. And it gets to be on that. We were talking with Gemma's friend John about the autism spectrum. It gets to be on that spectrum where you just like to have things just so, you know? Um, things are just perfect and just where they need to be. And if they're not, then fucking holy shit, we're gonna have to take, you know, blow everything out of the water, uh, and regroup and put it back correctly. I get that way sometimes. Um,
Mm.
and, I'm just flying off the cuff here, uh, trying to put it in terms uh, that, what, layman's terms, I guess. You have a routine and you don't like to change it up. Exactly, Hattie. Thank you. That's what I'm saying. I like my uh well, I don't know that I don't want to go 100% in on that. I don't want to go 100% in on saying that I have a routine and I don't like to change it because I will do other shit. I will do um I will, mix and mingle and I'll go outside of the box for, things. Especially in my job as a firefighter, you have to think outside the box.
Mm.
You have to be good on your feet. It can't always be routine. You can't teach the ABCs. I mean, you can instill, little bits of information, but until you actually get out there and fucking do it, then and I'm just going off on a tangent right now because Gemma loves I always look over at the camera when when I get cussing and swearing. Yeah, but um, something just hit me there. Where what?
It wasn't me.
What?
Nothing. Continue. I was just saying it wasn't me that hit you, though.
No, but what I'm saying is that I understand the introvert side of things. I don't.
Mhm.
I've never felt panic about leaving a house or a safe spot. Actually, fuck. Let me back that up because I actually might have something for you. Um, I did kind of panic a little bit when I uh, left rehab
Mm.
because that was a big deal. Um, Mark Gage, thank you for the resubscription, and Eric J Gaming, thank you for the resubscription. Um, wanted to, yes, get that. Let me go back to the rehab. I have talked about my stay in rehab ad nauseum on this broadcast. Uh, yes, Tim fucking Conrad went to rehab. We get it. However, it was a huge moment in my life, obviously. Um, and then, so in rehab, you're in this protected little bubble, right? Like
Mhm.
I couldn't drink. I couldn't. I was safe, you know,
Mm.
from myself. I was safe from myself. Um, that was the best part of it because I was killing myself. Um, what I was doing was not working, from day to day. I
Mhm.
just could not get out of my own way. I found I was scared to death of going to rehab. I didn't want to be that guy that went to rehab and oh shit, blah blah blah. But once I got there, my God, it was the best thing that ever happened to me. Anywho, now I'm here. I'm in this protective bubble, right? So when my mom came and picked me up at the end of my 44-day stay, um, I was scared shitless. I was. That was probably the most uh, agoraphobic I guess I could ever uh, try and feel.
Mhm.
Uh, you know, try and feel. Uh, I can't fucking put the words together. And there's Penelope. But that was it. Um, and that was my experience. And I just had this shining fuck me moment like, holy shit, here we go. We're going out into the real world. And
The big bad world. You can go out there
yeah,
like
it's
in there.
time.
You. It's like in a way when you have kids and you can keep them like when they're babies and you do things everything for them. You can keep them safe. And then when they get older, you have to let them go out there in the big bad world and make their own decisions, make their own mistakes, and you just gotta have to hope you've taught them enough. And it's like that, I guess, with anything. I know when I'd been in the hospital for a while after my self-harming stints and stuff, I couldn't do anything there because there was nothing to do it with. And it's like going out there again. Being in there, being in the protective bubble, I guess, of like what you are when you're a child. Everything's within reason, controlled, so you can't do anything, you can't hurt yourself, you can't do anything that's bad for you until you get out there, and then you have to make your own choices, make your own decisions, make your own mistakes, make your own way in life again. And you just gotta hope that what you're doing is right, and you never know for sure until you do it. Now,
Indeed.
yeah, no.
Well, there you go. I just Gemma and I were talking before this episode started, and she has a little bit of here and there about it, but I
Mhm,
didn't really know what the hell to say in this episode, and I think we just squeaked out a good conversation there.
mhm,
Um, so I knew this was going to be a tough episode. They're not all going to be easy, um,
yeah,
because I don't know fucking everything about mental health. I know my shit, you know,
mhm,
and I love learning more about it. Um, but uh, we're here to do shows for everybody. So, like,
mhm.
if there's ever an episode that you want done, we'll do it. It might not be the best, uh, but we'll string something together. I think we did pretty well here.
Every day's a
And
school day, and we're learning together, right?
yeah, we learn together. Um, and I know it's a little early, but that is literally all the information I have on agoraphobia. Um, but please, if you guys like the content, like the replays and everything, please share it out, and please help us grow. Please also look at the intro that Gemma put together for this month. It is excellent. There's a lot of good information in there. Discord. There's also the. Can you hear Penelope right now?
Yeah, yeah.
All right, Gemma, can you run through the intro stuff? I'm gonna mute.
Or the outro as well, unless you want to start again and do the show again, which I'm assuming not. So we'll
No,
do
I
the
mean,
out.
like, can you just run through some of the stuff that you put into the intro, please?
Yeah, yeah. Oh, with it being Christmas time, holiday time, December, there was there's a lot of people, as you know, that struggle at this time of the year, myself included. But I thought that um, one thing I did, I went around and had a good research into numbers that you could phone if you. It's more generalized mental health if you need someone to talk to. So within the intro that we'll be playing throughout December, there's scrolling numbers for. As far as I'm aware, I've included everywhere from every country that I know that we have viewers from. So if you happen to be from a country that isn't on those numbers, do let me know and I'll add it. But yeah, there's lots and lots of different numbers you can reach out to, not just at Christmas time, but anytime. But I
Yep,
thought, especially leading up to Christmas and the holidays and things, you just never know when you might need it. So you can screenshot your numbers or whatever that are on there and just keep it handy just in case. There's no shame in asking for help.
absolutely, and thank you. Um, Guys, please check out the Discord. Everything Gemma just ran through. Check out the socials. Check out Hattie's dropping all the links, and we're gonna call it early tonight. We're gonna
Mhm.
get out of here. Um, I'm sick. I need to go lay down. Um, and I hope everybody has uh, a good week, good holidays. We're gonna keep on going. Please keep tabs on the Discord because I don't know. I need to see what's going on for the week of Christmas and all that. I don't think we're going to be streaming. Um, it's the holidays, so
Mhm.
everybody have a good Christmas. And Hattie, thank you for dropping all the. Um, Let me run through the community calendar before we do get out of here. I'm sorry that this was a short one, guys, but I am just my head is not feeling great tonight. And We did have a good conversation, though. I think we eked more out of that episode than I was. I surprised myself. Went on a little tangent there. Um, but yes, check out the Mental Health Hour. Um, every Wednesday, we're here. The holidays are going to be a little touch and go. We will keep you up to date in the Discord on the upcoming weeks, um, on what we're going to do. So probably not next week because I think next week is Christmas week. Anyway, uh, Jim in Chicagoland, Catalyst tonight. Please hop over and say hello to Jim, our good friend and a year-long subscriber, along with Hattie and Ray and all of you awesome folks out there. And shit, it's the holidays. I'm bugging. uh, Check out all the links. We got the Beard of Weirdo show, and I can't not mention where's Ray? Where's Ray? Ray, I see you in the chat. A ray of sunshine. I saw you put out a post on Discord. You're not streaming tonight, but do well, be well, and take care of yourself. Um, please. And that should be everything, I think. Oh, Ella. For all things bunny, please check out our great sponsor, Ella the Bunny Mom. She's streaming midnight to 5 a.m. or something. I haven't seen her in a while, and my sleep schedule's been a little bit fucked. But go to www.mybunnyvalentine.com and check out her merch at the My Bunny Valentine store and help her support Ella. We love Ella. FireDude15 is the promo code. It's still active. It's forever active. I hope, because we always say it. So anyway, this was kind of thrown together, and we wish you guys Merry Christmas. I
Yeah.
think we're gonna take next week off, right, Gemma?
Yeah, I've got loads of stuff to sort out and things, but we might get one in before Christmas, maybe.
Yeah, keep an eye on the Discord. You never know.
Yeah,
We might
I've
pop up
got,
with a special
I've got one
episode.
hopefully tomorrow, but then definitely Saturday, 8 p.m. UK, 3 p.m. Eastern, doing some Christmas baking with company. I'll have company with me baking, so check that out. And I don't mean Thomas this time, although I do expect that he'll make an appearance. You'll hear him one way or another. He usually comes in arse first.
Right on, right on. All right, guys, we're going to get out of here. I'm going to go lay down and take care of myself. Take care of yourself, and
Yeah.
please practice some self-care and reach out, hit those helplines, hit the Discord, hit the socials. Goodbye.
Bye.